More than 4 million cases worldwide, months of lockdowns, crippling economies and the pressure to resuscitate them. As countries struggle to deal with the coronavirus pandemic, some have begun easing lockdown restrictions, a much-awaited step for many across the world. But the fear of a resurgence or second wave is real. South Korea, a nation lauded and held up as a global model on how to stem the spread of the virus, is now battling a new outbreak of COVID-19. This comes after the government started transitioning from intensive social distancing to what it calls distancing in daily life. Officials reported more than 100 new infections across the country, with Seoul's biggest nightclub district, Itaewon, being the new infection cluster.
이번 유흥시설 집단 감염은 비록 안정화 단계라고 하더라도 사람이 밀집하는 밀폐된 공간이라면 언제 어디서나 유사한 상황이 발생할 수 있다는 경각심을 일깨워 주었습니다. 끝날 때까지 끝난 게 아닙니다. 마지막까지 더욱 경계하며 방역의 끈을 놓지 말아야 하겠습니다.
Almost 20,000 people tested, prompting authorities to reimpose restrictions and shut down all clubs and bars. In neighboring China, a spate of new cases is also raising concerns after 70 new COVID-19 infections were reported. 6 of them in Wuhan, the epicenter of the pandemic, where a stringent lockdown had just been lifted in April. And other fresh cases were reported in the country's northeastern provinces, 3 in Jilin and 1 each in Heilongjiang and Liaoning. Singapore's coronavirus response was perfect until it relaxed the restrictions. In the beginning of April, the country had less than 2,000 COVID-19 cases. That has now jumped to 23,000. Nearly 80% of the infections re-emerged in cramped dormitories, used by thousands of foreign workers. A clear indication of how fast the disease can re-emerge where physical distancing is limited. Despite this massive rise, authorities now say the situation is stabilizing. But with no vaccine or antiviral medicine to prevent or treat the novel coronavirus, new flare-ups suggest that lifting lockdowns too soon might increase the chances of a second wave. The World Health Organization warns that any lifting of lockdowns to contain the spread of the coronavirus must be gradual.
To protect lives and livelihoods, a slow, steady lifting of lockdowns is key to both stimulating economies while also keeping a vigilant eye on the virus so that control measures can be quickly implemented if an upswing in cases is identified.
As Europe began to reopen its economies, a global alarm was sounded over a potential second wave of coronavirus cases after Germany, another country that was successful in limiting the spread of the virus by extensive testing and tracing, reported clusters of new cases at elderly care homes and slaughterhouses. According to Robert Koch Institute, Germany's closely watched reproduction rate climbed to 1.1, meaning 10 people with COVID-19 could infect 11 others on average. A rate that stays above 1 means the virus is spreading exponentially. The number stood at 0.6 when Chancellor Angela Merkel initially announced the easing of restrictions. Likewise, West African countries have started to lift restrictions, but Senegal's second biggest city, Touba, is fighting a fresh surge of COVID-19. Confirmed cases have risen sevenfold to more than 190 since a trader fell ill in April, ending a 2-week lull in new cases. Past pandemics have resulted in multiple waves of infections. The 1918 Spanish flu, which killed 50 million people, bounced back in multiple waves. The second wave was far deadlier than the first, partly because of mass gatherings from Philadelphia to San Francisco. The 1957 Asian flu and the 1968 Hong Kong flu pandemics also occurred in multiple waves. The 2009 H1N1 swine flu that emerged in the US in April that year was followed by a second wave in autumn. Based on these studies, experts say a second wave is likely to occur this time as well. In France, which has just begun partial deconfinement, immunologists anticipate the same thing.
And I know that in China there are ongoing cases in some places again, so it will be probably the case. I think there will be a second wave, but the problem is to which extent. Is it a small wave or a big wave? It's too early to say.
Half of the states in the US have also eased their shutdowns to salvage economies, but data monitoring shows that people are becoming increasingly restless and leaving homes too often, raising fears. Dr. Anthony Fauci, a key member of the White House's coronavirus task force and one of the world's most trusted experts on infectious diseases, has also warned against the risks of reopening the economy too soon.
There is a real risk that you will trigger an outbreak you may not be able to control, which in fact, paradoxically, will set you back, not only leading to some suffering and death that could be avoided, but could even set you back on the road to trying to get economic recovery.
The new wave of infections in South Korea, Germany and China is a grim reminder of how tricky it can be to apply effective strategies to keep economies rolling while simultaneously controlling the pandemic and saving lives. Until a vaccine is developed, social distancing, rigorous testing, contact tracing and isolating infected people are the only options we have. But will countries be able to stop a second wave of infections?